first talk of our today's session, I would like to invite Dr. C.S. Buch sir to share his presentation and initiate the talk of the town, that technology talk that is on tide, technology in diabetes evaluation by Dr. C.S. Buch sir, who is the consultant at the Baroda base, and he is involved in plenty of activities, especially in technology as well as the chronic care. So, sir.
Yes. Good morning, everybody. Dear colleagues, I am Control Sugar Buch at Baroda, running Puja and NRI clinic. As you all know, I am supposed to be talking today. Our subject is tide. There is a tide in technology, in diabetes evaluation, examination. Am I visible correctly with the presentation?
Yes, sir.
Fine. So there is a tide, and we know that we are able to do this meeting today thanks to the technology. So that is the technology and ICT which is permitting us to all meet each other from our home. And that is the objective, is that what are the technological innovations which have occurred, and in short, in the subject of diabetes. Why do we need? We all know. We don't have students here, we have consultants. What are the things which have happened? When are they useful? Are they in the early diagnosis or before diagnosis? Even before getting serious disease, in pre-diabetes, in diabetes, in post complicated diabetes with requiring assistive devices. So it is everywhere. And which innovations have helped and which segments have been helped is what I will summarize in next 7 minutes. My clinic is Puja Clinic Lab Nursing Home, and it is based on the medical components of the hospital and others. So the patient goes to consultants, and then they're sent to lab and themselves read in library. You need nursing and nutrition, hospital and hospital care. So for every aspect of healthcare, PCLNH, there are innovations. This robot is trying to cook, but then that is an old story. What we have at even SSG hospital is the nursing robots, more than one, and donated by the L&T and developed locally in Baroda. So what I'm trying to tell you is that diabetic tech is changing scenario by apps, by point of care testing, online education, remote examination, remote evaluation, assisting devices, sensors which are wearable, non-invasive, invasive, implantable, and we have 3D printing, which also we do it in Baroda, and we have hyperspectral imaging, for which I am a member, but the main base ISRO is in Ahmedabad. I work with them. And then about the IoT devices. Why do we need to know? Because we are all now connected and living a connected life, and it has changed the global future. Mobile computing, sensors, diagnostics, health, fitness, everything has come into one arena, and we are really in Vasudhaiva Kutumbakam, Eva global village ma apne avi chukia chiye. Google, you can understand, will never invest unless they see a business. So Google is investing $50 million with AHA. That is another way. Pragnesh bhai has to know that 50 million જેવી amount પણ લોકો healthcare IT માં involve કરે છે. So we need to think that the Google car, like that, we may have the hard advantages thanks to Google, and therefore we need to innovate and use the innovative technology in healthcare. What is used or desirable by the users is one aspect, but the second aspect is what is possible with technology. And if both are there, but if it has no market, we cannot do it, and there is no advantage. So when all three, the desire, the possibilities, and the viabilities, they meet, then that innovation will change. It can be initiated by an agent like a company, and they will research and put it in the market, or parents of diabetic children type 1 who themselves are tired of the lack of speed of technology, they themselves develop it, and then they share it with other people. So for technological innovations, for technovations, a good idea, better resource, better process, better products, results, cost effectiveness, deliberate use of information, not only imaging, but imagination and initiatives are very essential. Enhancement of efficiency and flexibility in working, in competition globally, and global social value enhancement are the ingredients of success. And therefore, all of us who are involved in the diabetes care, we are aware that diabetes management now, from the time the patient takes appointment to getting the SMS reminder cancellations to getting into the clinic and filling up an e-form, or even before coming, all these things, and up to the last, and even operations with robotic surgery, everywhere technology is involved, and we are aware about it. This is true not only for established markets, but even emerging markets. And in fact, now it is the reverse, that the new things are introduced into the countries with high demographic numbers, and then after testing, it is used in the established markets. So that is where we are. And as we all know, India, the new India, is already having connected villages. We have Wi-Fi villages, and time is not far when e-diabetes will be on every consultant in every part of the country, every part of the world, in the smallest villages in Africa. And students from USA, New York are following up the projects in Africa. So there is no doubt that we will be able to do this. New ideas are coming up, and three main areas where technology is helpful, where the life-saving technological advantages are in the healthcare, and we are already used to it. Some of it, I'll just mention it because you all are aware about it. But let us see that a nurse may not be able to shift. You don't need a stretcher. You can use a robot. You can use a robot for food, for diagnosis, for medication, for injections, for surgery. And the pilot project in New Yorkers for 670 patients diagnosed with pre-diabetes, they are trying to do, with the help of Noom, a program that offers users a preventive protocol, how to prevent them from going from pre-diabetes to diabetes and things like that. And I also work with a company in Silicon Valley in San Jose, and with them on telemedicine in the local language world over in those countries, we have done 8 lakh consultations.
So 2 minutes.
Yes. So this is the e-visit. These are the sensors, and the people are trying to kill their enemies by hacking these sensors. So be aware about it. And this is all what we use in daily life. And therefore, Google Smart's corneal measurement of the tear sugar was there, currently not so much in vogue. And this is a small 3 days pump, which is between pump and pen, and it can help to take care. Apple Watch, tactic feedback, these are the things Night Scout developed by parents of children to monitor their children. We will have capsules from which the insulin can be injected into the body, and insulin which can be smart, so that it can work released only when the sugar is high and not when it is not high. Deep breath aphasia, you are aware about. The forgetfulness of the patients can be helped by digital attachment to the pens, and these are the few models. And this is my friend Professor Zhen Gu at University of North Carolina, and he has developed this nano patch which may inject based on the blood interstitial level, glucose levels. Pressure maps we know about. Neurometrics have come out with diagnosis in 30 seconds of diabetic peripheral neuropathy, and once diagnosed, the pain can be relieved by wearable diabetic device. And therefore, embryonic stem cells, printing of skin, blood vessel printing I saw in Raleigh in person in the lab with PhD students. Replacing cartilage and bone in Michigan is ongoing. Patching a broken heart and replacing organs, and 3D printed body parts, including the burr hole and the skull 3D CT scan and manufacturing. For children with amputated hands, we can make them work again. So these are not only in USA, but in India. In a hackathon, we found that for an innovation to be useful, it has to be available, accessible, affordable, appropriate, and acceptable. If we do that, E-Stick, Chinicum are the Indian projects. Sparsh for diabetes peripheral neuropathy is an Indian project. Bed sore detection is a project. and Wi-Fi therapy in New York and Washington DC is going on, which has everything that you need. All these things are done by private sector and public sector, and public-private partnership only will be able to have this international cooperation and norms, and we know this, and we don't have to go beyond this. In today's talk, only introducing how is technology helpful to us, and there is a tide in it. Every wave about it during subsequent months, whenever Dr. Yash says, આપણે ટેકનોલોજીને કેટલો યશ આપવો એ નક્કી કરશું. Thank you very much.